what is it about the rehab ecosystem that you love so much?
I think that it's in other specialties, a lot of times you're kind of like not fly by night. That sounds bad, but you see your patients in very certain points, right? Like you'll see your orthopedic surgeon for a pre-op. You might see him for an injection to try to stave off surgery. You'll see him 6 months later to see if it worked, right? Then they'll schedule you for a pre-op. They'll see you for your surgery. They'll see you 6 weeks afterwards and then follow up in a year. With rehab in particular, like I said, we're seeing people a couple times a week, usually for extended period of time, 6, 8, 12 weeks. So what you're able to do in that short amount of time, even though our length of relationship might be shorter than like an orthopedic surgeon, it's much more intense, and we're able to build stronger relationships that we're able to, if you're doing it right, leverage on behalf of the patient to help achieve better outcomes and for the long run, better health.
Right. Now, I remember from your interview as well, I asked you how do you measure quality care and what are some things you've put in place? And you have like a manifesto with 7 points. And one of them is you really wanted your patients to be empowered to take their healthcare back, in a sense, into their own hand, have some sense of responsibility for it. And I think that's great and fantastic. And one of my questions then is, how does that happen? Because it seems like today, most people look at medicine like they look at getting on an airplane. Like they don't want to try to fly the plane. They just want to sit and say, tell me, you can tell me what you're going to do, how high we're going to fly, how fast we're going to go, but just make it go where it says on the end of the ticket. I want to end up in Seattle, not Boston. So do people really take responsibility, or are they just wanting to for you just to spoon feed them what you want them to do?
I think it's a little bit of both. For the most part, people, especially because I'm in rehab, so we're seeing folks that have a lot of chronic musculoskeletal pain or musculoskeletal pain in general, which our country spends millions and millions of dollars a year trying to fix, where there is no quick fix, right? You're not going to get a pill. For those patients in particular, they are looking for something. They're like, listen, tell me what I need to do. What do I need to put in place? How do I need to change my lifestyle in order to not feel pain, right? Or in order to be able to do what I want to do. So that's an easier sell for empowering patients. The other, probably the other 40%, 50% of patients that you see might just want a quick fix. And we rely very heavily, at least at ProActive, on education. So we do educate our patients a lot of times on what the options are, what the outcomes could be given which option they choose, what factors they have at play. Even in the greater landscape of healthcare, patient choice and patient empowerment is, at least on paper, a virtue that the powers that be would like to push on everybody. The problem is that most of these patients go to a doctor and the doctor says, okay, these are your options, make your choice. And because the doctors are pressured with time and they're seeing 7 minutes with a patient, they're trying to move on, they end up giving this patient some pamphlets. These are your 14 or 5 options, whatever. It doesn't really matter the number. Here are your options. You got to read these over and make a decision, because we're able to see our patients for a longer period of time, for longer appointment times, and then kind of that intense plan of care that I mentioned earlier. We're able to take the time and say, okay, like this is what that pamphlet means in reality.
So you're the interpreter in a sense, middle person.
Yeah, I very much like to say, for most of us ancillary healthcare providers, like our real job is being a knowledge translator. We're supposed to take what I call our vast, heady knowledge, the technical knowledge of healthcare, and we're supposed to be able to distill it down in easy to understand language that our patients can understand, but then also apply it to their specific situation.